You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. Who's a candidate? According to my first guest, he says no more dentures. He is North County's implant dentist, Dr. Henninger. Dr. Henninger, welcome to the program.
Thank you, Randy.
Now, thanks for coming to the show. We didn't beg you, but we've been trying to get you on the show legitimately for about a year and a half. Is that right?
It has been almost a year.
What was your hesitation? I'll put you on the spot here.
Randy, you're in the office so much, just seeing
I do come in there.
Yeah.
I do come in there. So, okay, good. Now, before we get into today's topic, for people that don't know you, who's your typical patient? What are the procedures you do? I know you work with Dr. Henninger, which has been on the show. But what all do you do? Because you do more than just dental implants.
Randy, we see all types of patients. We're a family practice. We do cleanings. We treat people that have gum disease. We have a laser in our office to do that. We do Invisalign. Okay. We also are a metal-free office. We do CERAC crowns in a day.
Do people come in now to actually have them taken out? Is that popular?
It is very popular, especially here in North County.
Okay.
There's a lot of people with aging dentistry that have a lot of silver in their mouth, and it just needs to be replaced.
And cosmetic? You do a lot of cosmetic?
We do a lot of cosmetic dentistry. And of course, a big part of our practice is dental implants. There's a lot of people up here in North County that have dentures that don't fit well, okay? Or a lot of people that are faced with losing, a tooth or a number of teeth.
Okay. Now, we've talked off camera. We said, I asked you in my green room, how many people do you think are wearing an upper lower denture in San Diego? Because I don't think of people having dentures all over the place, but you say it's common.
It is very common.
How many? What's an estimate?
Probably 30,000 people.
30,000 people.
Are a dentist are wearing dentures.
Like upper or lower denture?
Yep.
And you say what to that?
I say there's no reason why you should be walking around with loose-fitting dentures. We have dental implants. We have laser dentistry that is virtually painless. There's no reason for it, Randy.
So what's changed over the last, several years that makes it easier or quicker to do dental implants? What used to take, 6 or 9 months now can happen in just a few visits.
Randy, it's quicker for a number of reasons. The dental implant technology has changed quite a bit over the last 5 years. The surface technologies and the design of the implants
What, the bone grabs onto it faster?
Yeah, absolutely.
Okay.
Yeah, it's called osseointegration. What happens is the bone integrates with the dental implant, and that process happens quicker with the new surfaces technology that they're using on dental implants.
Now, when I hear, in an ideal situation, that you can go in with a missing tooth and the same day get a tooth and walk out with a tooth, with a dental implant. Is that true?
It's true.
Okay.
Not everybody can. It depends on what you present to our office with, but a lot of patients can walk into our office with a toothache or tooth problem that can't be fixed and walk out with a dental implant and a tooth on top of that dental implant. That's what's really exciting about dental implants, is there's a lot you can do with it these days.
Now, in your office, I guess you do all stages of the process, and it's not always done that way.
Right.
Elaborate on that.
Randy, we can do the process from start to finish in our office. That's not the usual way it happens. Usually you have to go to a specialist or a surgeon to have the dental implant placed, a couple of visits with him. And even before that, you're going to go to an imaging center where you'll get your three-dimensional x-ray taken. Okay, and then you have to go to another dentist to get the tooth on top of the implant. Okay.
So three different places.
3 different places.
Oftentimes.
Yeah.
Is that right? Okay.
Yeah. And in our office, we have everything under one roof. We can do the dental surgery in your office, we can do the x-ray, and we can do the restoration in our office. And the reason why I think that's better is the same guy who is going to make the tooth for you and make it look good for you is placing the implant. He knows where that implant is supposed to go, Randy. And I think that's a huge advantage over going to different offices.
But do you hear that people say, I don't like...
Absolutely.
Even to you, because you seem like such a nice guy.
Yeah. The first thing they want to know is, can you do the whole thing in your office?
Oh, really?
They're saying, because I've heard I have to go to here, I have to go to a surgeon, I have to go to a restorative dentist, I have to go somewhere else to get my x-rays taken. That's the number one complaint that I hear from people, is I just don't want to go all over town to get one job done. Yeah.
Okay. And so who is the typical client? And I know you guys are on TV, like Dr. Henninger's on TV. Who comes in, who for dental implants these days? Is there a certain demographic or kind of people?
Randy, we have young patients and we have old patients. Older patients that may need all of their teeth out. And that's a big deal. But for some reason, they've come to this conclusion and they've started believing the stories that they need to have their teeth out. That's probably our typical patient. They've come to the realization that they have problems in their mouth.
So they know their teeth have to go.
Mm-hmm.
So it's like dentures or get a fixed set of teeth.
Exactly.
Seems like an easy decision, right?
Right. Nobody wants dentures, Randy.
Okay.
Okay. And there's some people that already have dentures that have gotten to that point of frustration where there's got to be something better out here. And there is. That's
when when we say things like no more dentures,
right?
Is that an overstatement or an exaggeration? Is that the future of dentistry?
No, that's
'Cause you think that's true.
That's now, Randy. You can have, if you're missing all of your teeth, you can have your teeth back. Okay, we can get you 95% of your function back.
What does that mean, function?
That means you're smiling, you're chewing. You know, if you're wearing a set of dentures, you're probably functioning at about 20% of what the average person has when they have their natural teeth. With a fixed set of teeth, we can get you 95%, 100% back to normal.
Okay, so let's say there's 20, 30, 40, 50,000 people in San Diego that have an upper or lower denture, right? Mm-hmm. If it's so good to get, I guess even a couple of implants for snap in, snap out,
right,
why isn't everybody doing it? What's your take on that?
I think fear is probably the number one reason, or that they just don't know what's available.
Okay.
Okay, and that's part of the reason why we're on this show today, is to let people know what's available, and to let them know that it's not as painful as you probably think it is. Okay, we do a lot of our dental surgery and our placement with dental implants with the laser. Okay, and our CT guided surgery. Okay, that makes it more precise, more accurate, and less pain for you.
So let me get this right. I mean the pain is really from the gums, like digging into
Right.
the gums.
Yes.
Because the bone doesn't really have the pain.
Right, the nerve endings.
So that's why this thing doesn't hurt, this procedure, I'm saying.
Exactly. The nerve endings live in the gum tissue. If you can be kind to the gum tissue, it's not going to hurt. Okay, and when we do this stuff with a laser instead of a scalpel, we don't have to flap open your gums, it's less pain afterwards.
Now these denture wearers obviously don't go to the dentist anymore.
Right.
Right? So nobody's telling them to do it.
Right.
I mean, is that your take
It is.
also?
Yeah. Usually these people have come to a point where something dramatic's happened. They've gotten a divorce, somebody's died, or I have this great story about my friend Mary. You know, she's had dentures for a long time, okay, and she recently had a grandchild. And her grandchild's gotten old enough to where she's noticing things, and she's like, "Grandma, your teeth are terrible." And Mary's,
Wow.
Mary's my friend. You know, I've known her like outside of the office for a long time. And she came to me, she's like, "You know what pushed me over the edge? It was my granddaughter noticed that my teeth were terrible." And that's what made me want to come in.
So it's like some sort of a trigger
Right.
that gets people to want to do it.
I have several patients that have, lost a family member or gotten a divorce, and they realize they got to get out again, out in public, and be in front of people and attract people, and they got to do something about their teeth. That's the first thing that they realize.
What are the oldest patients you have getting dental implants?
We have patients in their 90s and even 100.
90 years
Yeah,
old?
Exactly.
100?
Right.
Why do they want to do that though?
Randy,
at 100?
Eating is a very important thing for us. Not only is it where we get our nutrition from, but we get a large source of entertainment and satisfaction from eating. And people may know that they only have 5 years left. They want those 5 years to be the best 5 years that they've had in their life. My grandfather, he's this big Italian guy. He's been wearing partials and dentures ever since I was a kid. And I knew it. This guy enjoys eating more than he enjoys breathing.
Okay. All right.
And I'm like, "Grandpa, why don't we get your teeth fixed so that you can enjoy what you enjoy most better?" He's like, "Oh, I'm too old. I want to go through the procedure." I'm like, "We can help you." And he's a family
So you
member.
were trying to talk him into dental implants?
Absolutely.
For how long? Did you finally do it, by the
Long
way?
time. No, I still have not
You
convinced my
haven't convinced him.
grandfather to do
How
it.
long is he? So he's got a loose-fitting denture. And what are his fears? I guess his fears are everybody's fears. What?
I honestly think he thinks there's nothing that can be done for him. And it's my job before too long. I'm going to get that guy a set of teeth so he can enjoy eating again.
Yeah. If you don't mind, I sent my father went to your office and he has dental implants. My father's 78 years old. This was a year ago, so he was 77 years old, right? He says, "My dentures are fine. They're great." And I'm thinking, he's got to be like everybody else. He goes, "No, they're fine." I literally forced him to watch one of my shows.
Right.
And he goes, well, yeah, I'll talk to them. So he goes there, he meets with you guys, Dr. Henninger, and he's a trumpet player.
That's right.
And he had a loose-fitting denture. So turns out he gets 2 implants, snaps in, snaps out. He calls me the next day and says, there's one thing, he's kind of a sarcastic guy, but he says, there's one thing he didn't do a good job. He didn't do a good job telling me that it wasn't going to hurt. Right? He said it didn't hurt at all. It was nothing. And my dad didn't want, and he told me, he goes, "I didn't want to tell you, but the night before, I hardly slept. I was so afraid." And he said it was nothing. It was just in and out. And now, of course, it's like he said, I should have done it years ago. And it's very important that a lot of people wait a long time. They're miserable for a long time.
Right.
And I think and I was thinking about this, and I think we've had this discussion that, my father's like a lot of people.
Yes.
That here at 78, he's been in dentures literally since he was 38.
Right.
Okay, and that's young. You know, who knows what would have happened, how his life would have been different had he been, you know, had a fixed set of teeth years ago.
Right.
So that is coming. So you hear those kind of things all the time.
All the time. You know, my friend Mary, she's really good friends with my grandfather, and that's actually how I met her. She had a catastrophic event where she broke something, you know, and she had to go, you know, fix it. You know, she couldn't walk around the way she was. And she's like, my mother had dentures since she was 30 years old, and I've made it, and I'm 80 years old, and I still don't have dentures, and I don't want them now. And she's like, what can you do for me? We did 4 implants for her, and we gave her a denture that snaps into place, and she's like, I was never missing my teeth. You know, this is as good as what I was dealing with before I had to have the rest of my teeth pulled.
Okay.
And to sit there and watch her struggle getting those teeth out of her mouth it just makes me smile so much.
Because they're so tight.
They're so tight.
Sometimes you have to loosen them to pull them out.
Right.
Interesting.
She was in just yesterday for a cleaning, and I sat there in the hygienist's chair and purposely did not help her get her teeth out, because I enjoyed watching her struggle with getting those teeth out of her mouth.
So no more dentures. Is this so? Is this the happiest group of patients? Because I know you do all things in dentistry. You do a lot of dentistry.
We do.
But are these the people that are most appreciative, as far as like maybe giving you cards or a hug? Or?
They are. They're the most appreciative because they experience the most dramatic change. Okay, they go from wearing these loose-fitting dentures to, you know, an implant-supported denture or a fixed set of teeth, and they often say, "Why did I wait so long, Randy?" I mean, you know, I get hugs and kisses, and it's sometimes embarrassing in the office because you're trying to, you know, deal with a lot of people in the office, and they want you to stop and hug them because they're
Is that
so
right?
thankful.
Is that right? So, you know, we haven't talked about your background training. I mean, you were a hospital dentist. I mean, you've and still on call, right in the middle of the night.
That's
people
scripts,
in accidents, things like that. You were a military dentist,
right?
So let's talk a little bit about your background training briefly, because I know you brought a lot of models, but your experience when it comes to dental implants.
Right. So, Randy, I did a residency in a hospital, and that's very rare for a dentist to work in a hospital. Doctors work in hospitals, dentists usually don't. Okay. But I sought out this residency because I knew I would get training with dental implants and also dental sedation. You know, I do a lot of sedation in my practice.
You do IV sedation?
I do IV sedation.
Not just oral. You do both?
I do both.
Okay.
Yeah. And some people don't tolerate the oral sedation very well. They're so anxious that the pill does not work. And that's when we do IV sedation.
Is that safe?
It is very safe.
Okay.
The patient's breathing on their own the whole time that they're in my office. They come back to me for their follow-up visits and they're like, I never knew anything happened. I don't remember a thing. It was great. And the nice thing about IV is I can control it. Once you swallow that pill, I don't have a lot of control about how your body digests that medication. But through an IV, I have direct control. I can give you more, I can reverse it. So it's actually a lot safer than oral sedation.
Is that right? So their blood pressure is lower, possibly?
It is, because their fears have been eliminated. Their blood pressure stays down.
They don't even
lower.
remember the procedure?
Don't even remember it.
Is that true, really?
It is. Honest
They go,
to
are
God.
you done?
Yeah.
Is that what they say when it's all?
I often joke with my patients that have their wisdom teeth out. We get done with the procedure and they're starting to wake up again. And I say, John, we're getting ready to start. And they're like, okay, but they're already done. They've already had their 4 wisdom teeth taken out and they're done. And they didn't even realize that we had started. So that's truly amazing. But I learned those skills in the residency that I did in the hospital. Okay, we had a lot of trauma patients in the hospital. So dental implants aren't only for old people. Okay, I have a lot of young people who have some sort of traumatic accident that come from the emergency room down at Thrips, and we solve their problems with dental implants.
So nobody, I mean, even though you do bridges and partials and traditional dentistry,
We do.
in a perfect world, I mean, you would never do that. You would always give them their teeth back with dental implants.
I would.
I don't want to put words in your mouth.
I would.
Is that right?
It's right.
Okay.
Randy, I believe so much in dental implants. You know, when I was trained in dental school, it was crown, bridge, partial.
Okay.
But I believe so much in dental implants. You know, throughout my career, I can count the number of bridges that I've done on 2 hands.
Really?
Okay. Because we're so successful with dental implants these days. There's no reason to do a bridge. There really isn't. Some people say, I don't have enough bone for a dental implant. We can do bone grafting.
Yeah, what about
procedures.
that? Because people do say that.
They
Even
do.
to me, because I go out sometimes, because my father, they say, well, I was told I don't have enough bone.
Right.
Or my medical doctor, my mother said this, my medical doctor said, I don't have enough bone.
And in the past, that may have been true. You may not have had enough bone for dental implants. With the bone grafting procedures that we can do in our office today, we can regain some of that bone that you've lost in order to do a dental implant for you.
Have you, in recent times, had a patient go into your office that said, I was told I didn't have enough bone?
Yesterday, Randy. Yesterday.
Really?
I
Okay.
had a patient yesterday. She had a bridge. The bridge was failing. By the way, the average lifespan of a bridge is 5 years.
Okay.
So if you count on the fact that you're going to have to do that bridge twice in 10 years, you have a dental implant.
So it might be cheaper to do a dental implant.
It definitely is.
Okay, so the story about yesterday.
Yeah,
Let's hear that.
yesterday. So I had this patient who had a failing bridge, and she's like, I need a new bridge. And I was like, why don't we do a dental implant? And she's like, I don't have enough bone. That's the reason I had to do this.
I don't have enough bone.
That's what she said to me. She said, I don't have enough
And
bone.
what do you say to that?
I said,
Who told you?
I said, let's go get a three-dimensional x-ray. And
But who told her she didn't have enough bone?
her previous dentist who did the bridge.
Okay.
Okay. So what we did,
You have a CT scan right there.
CT scan right there. We took a CT scan.
Is that painful? I'm kidding. I had one over at your office, right? It just scans you.
Yeah.
It's very fast.
It's just like having any other x-ray done.
Okay.
Yeah.
All right.
We took the x-ray, and I showed her how we could regrow bone in that area and put a dental implant in. We did IV sedation for her. She was a little bit nervous. We did IV sedation for her, did the bone graft. I was able to put the implant in and do the bone graft at the same time. And somebody's been telling this lady for 20 years she can't have a dental implant there. And we just did it
So
yesterday.
if you would have met her 20 years ago, it would have been less expensive than in the long run.
Less expensive and a lot easier too.
Interesting. Okay, so you brought some models. What are we
I did.
looking at here?
So these are our typical patient.
And for people just tuning in, we're talking about no more dentures, get a fixed set of teeth in just a few appointments. And of course, with us we have North County's implant dentist, Dr. Henninger, new to our show, even though I go to your office all the time. Not all the time, every 6 months, right, for cleanings and things like that. But we're talking about dentures. So these are options for denture wearers.
So the first option for denture wearers, Randy, is a denture with 2 implants. As simple as having 2 dental implants, you can have a lower denture.
So like on the lower.
On the lower.
Okay, okay.
Like I said, the upper denture, it works for some people.
Okay, hold that up. So so you can use our existing denture if you want?
Yes, absolutely.
And what, you just make snaps in there?
Yeah, we can reline it in less than 24 hours. Okay, with 2 snaps, you're going to have a denture that's held in by snaps. Snaps in, snaps out.
No more adhesive.
No more adhesive. It's a huge improvement over a lower denture that flops around.
Okay.
I love those dentures on the lower that flop around so much, because I know if we can do this for you, you're going to love it. You're going to be so happy. You're going to be one of those patients that's hugging me in the hallway.
Okay.
They can't stop hugging me.
You know, my father, I asked my father, and I told
That's
you I
right.
don't want to tell my story on the show, but my father went to your office, has 2 implants. And so I called him a couple of days ago, and I said, I'm going to interview one of the doctors over at Henninger's office. And I said, if you had to go back, like if they paid you, and I actually said to my father, I'm going, if they paid you $20,000 to remove those implants and just go back to your denture, would you do it? He goes, no way. He goes, there's no amount of money.
Yeah.
And this is a guy that I had to beg, like you have to beg your grandfather, that I'm telling him, you should try it, at least get a consult.
Right.
Can't go back. And you say, this is what everybody says.
It's a life-changing event. Just 2
Because
implants.
it's different, I guess, just chewing. We take for granted because we have teeth.
Right. With an upper denture, Randy, you can taste your food, but you're not getting the full enjoyment that you could out of your food.
Right, because there's taste buds on your tongue, obviously.
There are.
I think.
There are.
Okay.
Yeah.
Okay, good. So the next level up then is, so the upper, you can put what, 2 or 4?
We can put 4 implants on the upper, Randy, and we can remove the palate from your denture. Okay? And that gives you the full sensation of being able to taste your food again. Again, you have the advantage that your denture it snaps in, it snaps out. It's not held in by suction. No adhesive.
But you don't want to use their own denture, right? I mean, don't you want to make a new denture?
Right.
Cosmetic denture?
Randy, we do very cosmetic dentures in our office. A lot of people can't even tell that they're dentures. That's how good our dentures are.
I bet I could tell.
Nah, I bet you can.
I always feel like I could spot a denture walking down the street.
Right.
But you have a milling machine that makes things right there.
It does. Mm-hmm.
Okay, is that a savings to the patient, do you think?
It is. One of the advantages of us being able to do the whole process in our office is the cost savings to the patient. We're able to do, these processes in our office more affordable for patients.
Is it true that normally how it's done, you send it out to a lab because they have this 100,000 plus machine?
Right.
But you do it right there.
Yeah, we have the machine in our office.
Okay, good.
So-
All right. So for now, what about the next level up for the lower denture? So we've talked about 2.
We also put lower dentures on 4 implants. Okay, and the reason that's good is because a denture on 2 implants is held in by a combination of suction and snap. It does snap in and does snap out, but it is somewhat reliant on suction as well. If we can do 4 implants, your denture is totally reliant only on those snaps. Okay, so it snaps in, snaps out, and it will not move.
Do you have one of those
I do.
samples? So this 4, now you show this to patients? Let me take a look.
I do. These are what I use for
Let me
patients.
borrow that. Okay, so is this, and this is accurate of what it would be? Okay, so it just snaps on. Right here.
You can hear the snap.
Okay, so no more adhesive.
No.
For implants. Now, what
Absolutely
about
not.
fixed? A fixed set of teeth.
So that's the next level up. And Randy, I tell people that's the Cadillac of dentures. And in reality, it's not a denture. It's a fixed set of teeth. You're getting all of your teeth that are fixed.
Permanent?
Permanent.
Possibly? Okay.
Absolutely. These dentures, or fixed bridges as I like to call them, this is the denture that does not come in and out. It's a fixed bridge that only I can take in and out. And you come to see me once a year, I take it off.
Once a year to clean these?
Once a year.
And what do they do at home?
And I clean it.
Toothbrush,
water pick, just like a normal person would. Okay? We can get 95% of your function back with this fixed set of teeth.
And what is that made out of, by the way? Is it porcelain? Is it acrylic?
They're made out of porcelain, or also they can be made out of plastic. It depends on your bite. Okay? We're going to design it to where it's best for you. Okay? Some people have a really strong bite, Randy, and porcelain's not right for them because they'll break it. Okay? Right. We go with the plastic denture teeth in those cases. Okay? But people who have the average bite, we can put porcelain in your mouth, porcelain teeth onto your fixed bridge. Okay? And those are the most natural teeth that we can have.
Like a beautiful looking set of teeth.
It is.
How important is the smile in your opinion? Because there's a lot of denture wearers, you tell me, that don't smile because they don't like their denture.
Right.
So how important is smile?
Smile, in my opinion,
you're a dentist.
I'm a dentist.
I'm guessing that you think it's super important.
I do, but there's been a lot of independent research done that says that the first thing people notice about you is your teeth. I read a lot of literature, like the psychology literature. They do top 10 things that people notice. Smiles always number one.
Yeah.
You've probably read the Cosmo article or the fitness.
I don't read Cosmo anymore. I don't read it anymore.
Used to, didn't you?
But you're right. It seems like teeth are always in the top 3 or top 5, right?
Right.
Of attractiveness.
And your first impression with somebody, I always say your first impression is your most important impression. It has to do with a lot with your smile and your teeth.
So there's a lot of people in San Diego that aren't smiling because...
A lot of happy people in San Diego that aren't smiling, and people don't realize that you're happy.
Because they don't like their teeth.
Exactly.
Okay, so
they're self-conscious about their teeth.
So no more dentures. Get a fixed set of teeth, like what, 4 or 6 implants, 8 implants? Just depends on the situation.
It depends on the situation. We usually use 5 or 6 implants. Again, and that's not the important part, Randy. The important part is you're getting your smile back.
So do they ever come in and tell you eating stories?
Absolutely,
like what
Randy.
They ate?
Absolutely. The story that I hear most often is the older gentleman that hasn't had a steak in 4 years because of his teeth. He's able to eat with a fixed set of teeth. He can have his steak. And the story that I always like to tell people, can you imagine biting off an apple with a set of dentures? It's not going to work. Those dentures are going to fall out, and it's going to be an embarrassing experience for you. You could bite off an apple, eat a carrot, all those sort of things.
So if it's as good as you say it is, and if there's at least, let's say 10 or 30,000 plus people with an upper or lower denture, they just need to know their options. There's probably not even enough dentists to service all these people here in San Diego.
There's not, Randy. There's not. It's the patient doesn't know what's available to them. So going out and pursuing the information that's available and finding out what's right for you.
And your consultations are free.
They are.
We sent you somebody, by the way, that works here. They were going to go to somewhere else.
Right.
They were going somewhere else, and it was a $250 consultation.
Right.
And I overheard the conversation. I said, and I'm not kidding you, I didn't even know they charge for consultations anymore.
Right.
Right? And I made her go to you.
Right.
And
Randy,
I don't know if she saw you or one of the other people, but
right. Our consults are free. And Randy, the reason...
So, you might as well go in and get evaluated, right?
Exactly. And the reason why they're free is because I think you should at least have the information to be able to make a decision on what's right for you. Okay? And I'd rather you hear it from me than read about it on the internet or something like that. Because I can give you your options and the ones that are right for you.
So the CT scan, is that free too? If somebody goes in?
It comes along with the consultation.
And you take dental insurance.
We do.
Is that right?
We do.
Okay. Okay, we're going to hold that thought. We're going to take a quick break. And when we come back, more about options. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back. Now, we're completely out of time. Is there anything we haven't talked about?
Randy, we talked a lot about the older patient and what implants can do for a denture wearer. What we haven't talked about is the younger patient. There are dental implant solutions for younger patients too. I have a patient, Amy. She's actually my age. She has 2 kids just like I do, Randy. She's an attractive woman, and she's taking her kids all over town to soccer games and plays and dance. But she has such severe dental problems that she can't do those things.
Okay.
So we've gotten her to the point where she's realized that there's better options out there for her. And we're going to do...
But what if her gums are too bad?
Randy, a lot of people's gums are bad because their teeth are bad. Okay, they have so much bacteria living on their teeth that has affected their gums. Okay?
So what did you do for her?
we had to take out the rest of her teeth. And we put in 5 dental implants and a fixed set of teeth. And honestly, she looks better than she did with her natural teeth.
You know, I asked you on the telephone, and we are out of time, but I asked you on the telephone, and you don't know that I'm going to bring this up, but I said, you're going to be on my show. You're going to be on my program. Who, in a dream world, the perfect world, who would come in from this? And you said, people that don't have access to dental care because of fear or because of money or because of whatever.
Right.
And that was like, I thought, that's the right answer. It's kind of like doing it for the right reasons.
Right. And those are the patients that I get the most enjoyment out of seeing, because there's such a traumatic change in their life, Randy. You know, they're able to eat, they're able to smile, they're able to go out and get that job that they've been wanting to get for so long. You know, those are the stories that really just make me go and make me keep pursuing dentistry.
And you see changes in their self-esteem?
I do.
When they act differently when they come back?
I had a 23-year-old patient, did the consult just last week, addicted to drugs for like 4 years. He's gotten off of drugs. He's an amazing artist. He's gotten off of drugs. He can't get a job because of the way he looks, because his teeth are so bad, you know, from the history of drug abuse. And, you know, we're going to be able to change that guy's life. You know, he's made the first step by getting off drugs. You know, when we change his smile, his possibilities are endless.
So you see the outcome.
I do.
When you're on the consult, and you kind of get excited?
I do.
About it?
I do, Randy. That's the best part of my job.
Like when a denture comes in and tells you their misery stories, I mean, you get excited going, boy, this is going to be good.
Right.
Really?
Yeah, and the assistant who's sitting next to me, who's seen this process over and over and again, she gets that smile on her face like, I know what we can do for you, you know? And, you know, half the time, I don't even have to be there, the assistant. You know, she sees such dramatic changes in our patient. She just gets so fired up about it. By the time I get into the room, you know, the excitement is just out of control.
I want to thank you. Very good stuff. Really good.
Thank you.
It was a pleasure. And I'd like you to invite you back to talk more about the highly anxious patient and what you're doing with IV sedation. Right. You're watching the Wellness Hour, leader in medical news information. I'm Randy Alvarez. If you would like to see this interview again, or if you have a friend with a loose-fitting denture, you can go on our website at wellnesshour.com and you could put in Dr. Henninger, or you could put dental implants San Diego. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.